Hello everyone. So in today's session, welcoming you all. In today's session, we are going to start about the endocrine and metabolic disorders. And today's topic is all about the diabetes mellitus. So let's start the topic. Diabetes is a condition that happens when your blood sugar, which is called as glucose, is too high. It develops when your pancreas does not make enough insulin or any at all, or when your body is not responding to the effects of insulin properly. Diabetes affects people of all the ages. Most forms of diabetes are chronic, which is called as lifelong. All forms are manageable with medications, or other than that, lifestyle changes. Glucose mainly comes from the carbohydrates in your food and drinks also. It's your body go to the source of energy. It's actually the source of energy, and if your blood carries the glucose to all your body cells to the use of for energy. When glucose is in your bloodstream, it needs helps, which is a key to reach its final destination. This key is insulin, which is called as it's a hormone. Okay, so if your pancreas is not making enough insulin or your body is not using it properly, glucose builds up in your bloodstream and causing high blood sugar, which is called as hyperglycemia. So in your blood, the hyperglycemic index becomes more for the persons, those who have the diabetes. Over time, having consistently high blood glucose can cause health problems such as heart disease, nerve damage, and eye issues. The technical name for diabetes is diabetes mellitus. Okay, so another condition share the term, which is called as diabetes insipidus, but they are distinct. They share the name diabetes because they both cause increased thirst and frequent urination. Diabetes insipidus is much rarer than diabetes mellitus. There are several types of diabetes. The most common form of diabetes is type 2 diabetes, which can be found in lot of people and lot of this generation as well. So with this type of, your body does not make enough insulin and your body's cells does not respond normally to the insulin, and called as the insulin resistance. This is the most common type of diabetes. So it mainly affects the adults, but children also can have it as well. Another aspect of it, it is called as pre-diabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than the normal and not enough to be officially diagnosed with type 2 diabetes. Persons cannot be diagnosed with the pre-diabetic but can be diagnosed with the type 2 diabetes more. So another part of it is the type 1 diabetes. This type is an autoimmune disease in which your immune system attacks and destroys insulin producing cells. So in your pancreas, for unknown reasons, up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but also it can develop at any age. Another part of it, it is called as the gestational diabetes. This type and this develops in some people during pregnancy. Gestational diabetes usually goes away after the pregnancy, and however, if you have gestational diabetes, you are a higher risk of developing definitely type 2 diabetes later in the life. There are many more other types of diabetes, which includes type 3C diabetes. This form of diabetes happens when your pancreas experiences damage other than that autoimmune damage, which affects its ability to produce the insulin. And also the pancreatitis, pancreatic cancer, cystic fibrosis, and also the hemochromatosis can lead to all the pancreas damage that cause diabetes. Having your pancreas removed, you can go for it. Also under the guidance of the healthcare provider and your doctor, also results in the type 3C diabetes. So another one is the latent autoimmune diabetes, which is in the adults, and the short form is LADA. Like type 1 diabetes, LADA also results from an autoimmune reaction, but it develops much more slowly than the type 1 diabetes. People diagnosed with LADA are usually over the age of 30, and also maturity onset diabetes of the young, which is called as MODY, also called monogenic diabetes, happens due to an inherited genetic mutation that affects how your body makes and uses the insulin. There are currently over 10 different types of MODY, and it also affects up to 5% of people with diabetes and commonly runs in families. So, what are the symptoms in diabetes, which is called as increased thirst? Many people can found dry mouth, frequent urination, fatigue, blurred vision, and also unexplained weight loss. Numbness or tingling in your hands or feet also can be found. Slow healing sores or the cuts. Those people have diabetes, their wound cannot be healed very quickly. They have the slow healing process. Also, frequent skin or vaginal yeast infections. Additional details about the symptoms per type of diabetes include, which is called as for the diabetes 1. You can say for the symptoms of diabetes 1, it is called as can develop quickly over a few weeks or months. And also you may develop additional symptoms that are the signs of a severe complications called diabetes related ketoacidosis, which is called as DKA. DKA is a life threatening and also requires immediate medical treatment. And DKA symptoms include vomiting, stomach pains, fruity spelling breath. You can find out labored breathing. And along with that, type 2 diabetes symptoms or the pre-diabetic symptoms, you may not have any symptoms at all. For the pre-diabetes, you cannot find that the person is having the pre-diabetes. You have to go and check of the blood sugar first. Do not notice them, and since they develop very slowly. And also blood work may show a high blood sugar level before you recognize symptoms. Another possible signs of prediabetes is darkened skin tone on the certain parts of your body. And also the third, it is called as a gestational diabetes. So you typically won't notice the symptoms of gestational diabetes. Your healthcare provider will test you for the gestational diabetes between the 24 and 28 weeks of pregnancy. So what causes of the diabetes? First one, it is called as the insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when a cell in your muscles and fat and liver does not respond as they should to insulin. So several factors and the conditions contribute to the varying degrees of insulin resistance, including obesity, lack of physical activity, diet, and also the hormonal imbalances. Genetics is also the cause, and certain medications and autoimmune diseases, which is called as type 1 diabetes and LADA, happen when your immune system attacks the insulin producing cells in your pancreas. Another cause is the hormonal imbalances. So many people can be found that pancreatic damage is also one of the cause, genetic mutations, because diabetes is one of the cause of the genes. By the genes it can be carried. So what are the prevention for it? Because a lot of people are suffering from it. Eat healthy diet definitely, such as called as the Mediterranean diet, and also physically be active. At least go for 30 minutes of physical training, yoga sessions, and also along it's up to you what kind of work you want to do. And also manage your stress, limit any kind of drinks, and also get adequate sleep, typically around 7 to 9 hours, and seek treatment for the sleep disorders. Take medication as directed by your healthcare provider, managing existing risk health factors for the heart disease and all. So what are the part of yoga therapy? You can go for it. Definitely you can go for the leg up to raise the practices for the wall support. Along with that, spinal twisting practices, asanas. Along with that, you can go for the twisting asanas like Ardha Matsyendra, Matsyendra, the fish pose, Vakrasana. These different asanas you can try it. And with the support of the practices which is called as forward bending practices and spinal twisting practices, you can go for it for the yoga therapy. Thank you so much. So this is all about the session of diabetes mellitus. Thank you for joining it.